Good morning. Welcome to the 9:30 call today. We're going to start out with some centering slides to just remember where we've been and where we're going. So hopefully you can see my screen now. And we know, we heard this last week when we had Somerville on the call. So we know in the past few weeks, we've had two kind of big announcements in the early childhood world. So first, the EC 101 site was launched, which really is the context setting, the foundation setting for as we think about across the system of early childhood. And we, as we were crafting the early childhood agenda, used the same principles, the way that EC 101 has been organized. So health and well-being, family and caregiver support, early education and care, community engagement. And now today we are going to talk about the agenda priorities. And we are so excited to have Naomi Meyer with us this morning for Lift Our Kids. And this recommendation is really centered on this number 3. And the recommendation is to provide a guaranteed minimum income for Massachusetts families and ensure that we have an adequate safety net, expand the state earned income tax credit, create a robust and inclusive child and family tax credit, and raise cash assistance grants. And as you can see, there were 2 groups named as lead advocate. We heard from the Healthy Families Tax Credits Coalition on Monday, and today we're excited to hear from Naomi and Lift Our Kids Coalition. So as always, if you have questions for Naomi, please add them to the chat. Naomi, you should be able to share your screen if you have slides, and I'll turn it over to you.
Great. Thanks so much, Amy. I really appreciate the opportunity to share with you all about Lift Our Kids Coalition. Our campaign is focused on raising cash assistance grants. That is TAFDC, Transitional Aid to Families with Dependent Children here in Massachusetts. So that is something short of universal basic income because that assistance is not available to all families, but it is meant to be a safety net available to the very lowest income families to ensure that they have, at least the bare minimum to be able to take care of their children. I will share my screen, a couple of slides. But I want to mention that our coalition now has over 150 supporting organizations all around the state, and which I know includes probably some of the folks on this call. But if any of your organizations, after hearing about it this morning, would like to join, we would welcome you. There's a range of different ways. You can be a supporting organization simply by endorsing and putting your name on it. We'll add your name to our materials, but there's also plenty to do to get more involved for those who are able, in terms of urging the legislature to raise the amount of family grants that families receive. So let me try the screen share and see if that works. Can you all see my slides now?
It worked, Naomi. Congratulations.
Yay. I always have a doubt about whether it's going to go. Okay, so let me go to slideshow mode. Okay. So as I said, we have a really large and robust coalition. Mass Law Reform Institute and Greater Boston Legal Services, where I work, have been kind of taken the lead, but there are many other participants. And you can see here our website. I can also, at the end, I can put it in the chat. But so there's a lot more information about what we've done, press coverage, so on. But so here's basically what the problem is that we're trying to address. There is no cost of living adjustment built into our cash assistance program in Massachusetts. or either program. So there's the one TAFDC, as I said, the program for families with children. There's also a program called EADC, which is cash assistance for very, very low income elders and people with disabilities. These are both administered by the Department of Transitional Assistance. And because there was no cost of living adjustment built in, the grants were essentially frozen for many, many years. And what happens when there's no cost of living adjustment? They lose value to inflation. This is in contrast to federal programs like supplemental security income or SNAP, formerly called food stamps, which, not to say that any of those are enough, but they are at least adjusted for inflation each year. And because, as you can see here, there was one small increase to TFDC in the year 2000, but that was the only one since 1988. And so grants, the value has just been lost. And families it was never a lot. It was always below the federal poverty level, but it used to be considerably more, have considerably more value than it does now. So where we were from July 2000 all the way up until December 2020, so over 20 years, grants were frozen this is an example for a family of 3. The amount does change somewhat by household size, but grants were frozen for a family of 3 with a maximum of $593 a month, which, I don't have to tell you, is just wildly inadequate to survive in Massachusetts, raise your children, provide, the basics that they need. Our campaign, so the coalition is the Lift Our Kids Coalition. The campaign is called Lift Kids Out of Deep Poverty, because the goal is to get grants up to what's called the deep poverty level, which is half the federal poverty level. A very modest goal, but one we hope is actually, possible, achievable. But so since we started this campaign, we have successfully worked with the legislature and with the leadership of Representative Decker in the House and Senator DiDomenico in the Senate to get some increases. In the last 3 state budgets, there were the increases that you see here, 10% or less each time. But so bringing the maximum grant for a family of 3 up to where it is now, which is $783 a month. So, on the one hand, that's an incredibly welcome change. And we're really grateful for those increases and grateful that the legislature, has been listening to this concern. But we, of course, are not, $783 is still not enough, and we're not at our goal. But just to take another moment to talk about what has been accomplished, over the course of the last 3 budgets, we got a 32% increase in cash assistance. So, we take that as a sign that, we're having some success. And you can see the numbers here regarding the caseloads, how many people have been benefited. So 70,000 children in 39,000 families have benefited from those increases. Okay, but so this shows you the work that we still have to do. So the current, again, based on a family of 3, and actually I should take out the word projected, because this is now confirmed as the poverty level as determined by the U.S. Department of Health and Human Services for 2023. For family of 3, the poverty level is $2,072 a month. So half that, our very modest goal of the deep poverty level, is $1,036 a month. And then you can compare that with where we are right now, the red bar of $783 a month. So our work is not done, obviously. Just another way to think about these numbers is that if grants had been adjusted for inflation, just to keep up with inflation with no real increase since 1988, they would now be $1,350 for a family of three. And so you can really, this graph just shows you the lost value that families are facing when they're trying to be able to purchase what they need. So here are our wonderful lead sponsors, Rep. Decker and Senator Domenico at an event we had a few years ago back in the State House. So they have filed again this session bills, you have the numbers here, that would increase cash assistance grants by 25% a year until they reach this goal of half the federal poverty level. So based on current numbers, that would basically take 2 more budgets at that rate to get them to that goal. And then the bill would build in cost of living adjustments in future so that they would then be adjusted each year to keep up with inflation, with the increasing federal poverty level, and not lose value again over time as they have. Try to fix that problem in our system. And as you can see, we are on social media. We welcome folks to check us out on whatever platform you use, and see action alerts, media coverage, etc. Okay, but I'll let go of the screen share so we can see each other a little better. I see there's a bunch of messages. Are there questions for me? Oh, Amy, thank you for putting in the website.
Yeah, I put the, while you were speaking, I put the link in. I also put the link in of the recommendation. I know there's the board meeting tonight at 5 p.m. There's also a 10 a.m. forum around the financial assistance regulations. So I know Kim Dion was on, so someone has that link to add. And we also have for the financial assistance recommendations, we have the Greater Boston Legal Services summary, and then we also received one from the R&Rs, which we'll post on the 9:30 call. And Naomi, so there's some feedback. That's an incredible feat. Thank you for your advocacy, and yay, we need to do more. And then Ron Dorsey wonders, have you been tracking DTA's GI pilot with Up Together, formerly Family Independence and Independence Initiatives? Any thoughts about its potential?
So I, in terms of tracking, I haven't heard if there's latest. I know that they're doing the pilot. I haven't heard if there's any results put out there yet, but Up Together, I want to mention, is a member of Lift Our Kids Coalition. I mean, we're all on the same page about knowing that families need cash. I mean, they need lots of other things too. And we support, access to food stamps and housing and, everything, of course. But I think there is something fundamental, and I know this is why, it was selected, the issue of income and cash was selected as a priority by the early childhood agenda. Ultimately, families know what they need, right? And it may vary from family to family what their most pressing need is, and they should have the autonomy to decide, and cash is what enables them to do that. So, I think all of the groups, I know you heard from the EITC coalition, all the groups that are supporting the idea that families need more cash, have recognized that. And of course, there's huge amounts of research, which I don't have to tell you, but I'll just allude to that, the huge amounts of research showing that when families have more access to income, their children do better in a million ways, right? They need fewer health interventions. There's less need for special education. There's lower incidence of DCF involvement, just on and on. And again, I'm sure you guys are very familiar with with this. You know, just if families have what they need to take care of their kids, they take care of their kids. You know, and so as I said, if there are groups on here, I hope that maybe a few more of you who might not have been familiar with the Lift Our Kids work specifically might want to join our coalition. But even if your organization is not in a position to do that, I also, I'm going to, in a moment, I will plug in one other link, which is we have an online action that, quick thing where you fill out your name and address and it sends a letter, an email to your state legislators asking them to co-sponsor the bills that Rep. Decker and Senator DiDomenico filed, so that you can, support in an individual capacity as well. And we'd love to have that. For anybody who does want to get involved with the coalition more, we have monthly meetings. First of all, we're happy to add you to our email list, so then you get updates. You can sign up on the website that Amy posted. And we have monthly meetings on the second Monday of the month to, talk about the nitty gritty of our, of our campaign work.
And
so
there's just a clarification in chat. You used family size of 3 to illustrate the benefit amounts. Can you confirm that those amounts differ by family size, i.e. the target amount of family in 2 is slightly lower and slightly higher for larger families?
Yes. Benefits are currently based on family size. For decades and decades, it was about $100 a month more per additional family member, which was nowhere near enough, but was better than not getting an increase, right? Now that we've gotten it across the board increases, right now it's about $130 a month difference. But and the goal that we're moving towards of half the federal poverty level, the poverty level is also based on family size. So yes, it will.
So it's all connected.
Yeah.
And so I think also as we have released the agenda on January 24th, we had 5 priorities with identified organizations. And this is a kind of a good model where there's a coalition that exists that's working on this. We want to connect kind of all of our skills, talents, and expertise to that coalition as 930 callers and folks in the early childhood space. And our strategies is working on updating a website, because as we said on the 24th, this is kind of just the beginning. And so as Naomi posted the opportunities around legislation, around signing up for their coalition, we are building the new website to kind of have all that information in one place. As you can imagine, like getting the information, getting it up is taking some time, but we really see that as a place and the opportunity for these continual updates. We will continue to have folks on the 930 call if there are developments. The other piece I'll say in Naomi's slides, it said HD, which means House docket. So when bills are filed, they get a docket number first, and then they get a bill number. And that can be confusing if you don't live and breathe in the legislative ease of kind of bill filing. And so it's really important that we will be monitoring these bills as well and sharing updates. But each bill that gets filed gets assigned to a committee and then has a public hearing. And that's another opportunity to kind of show support for these issues. I'm going to turn it to Kim Dion, who I know has Naomi, I'll come back to you for the last word. Kim Dion has a quick update, and then we'll go to Naomi for the last word.
Yep, just up to the minute numbers on the early educators pilot program for getting their own kids into care. We have heard that there are 1,181 children on the wait list. That is a huge number in a really short period of time. So kudos for getting the word out to everybody. Of those almost 1,200 children, about 900 of them have already received funding availability letters, and 123 children are actually enrolled on a subsidy already. There's still about 250 on the wait list, and I will tell you a lot of them are in my area because we have a huge number in central and western Massachusetts, and I can't process everybody at the same time, but we're making really quick strides to get to those folks. So if anyone's on the wait list, they should be getting letters soon.
That is
exciting.
Incredible update.
It really is.
John. I think it's also such an illustration of we said there was a problem, the legislature responded, and EEC responded. We know that, you know, when a budget line item gets passed with language, turning that into reality takes time. And then the R&Rs for kind of collecting the information, getting it back out. So that is just incredible and so important to show the need and show the demand and to have that data. So thank you for that, Kim. Naomi, I'll turn it to you for the last word.
Oh, I just realized that it might be worth mentioning that in addition to the bills that we've been talking about, we Lift Our Kids is pursuing a budget campaign. As I mentioned, the increases that we've actually gotten so far have been through the state budget, which makes sense because, you know, even if a bill passes, it still has to be funded. So the budget is kind of where new allocations of support, you know,
Right.
resources come from. And so, you know, you can just stay tuned for as the legislature moves towards the budget process, stay tuned for updates on that too.
Thank you. Thank you so much, Naomi, and for all of your work, both at Greater Boston Legal Services and the work in the coalition. Also, just a quick update on the letter for the supplemental funding needed to continue the operational grants for licensed programs. We have got all that information in a letter form. We are going to get a message ready so that each of you can share the letter with your own legislators. We will be sending it to the legislature, but it will be even more powerful, as we heard yesterday from the representative about how important, you know, who they listen to, and they listen to constituents first. And so that will be another opportunity. We'll probably get that all together either tomorrow or Monday so that you can send the letter that was signed by 186 organizations and over 750 individuals to continue to get the supplemental funding needed for the operational grants for the finish of the fiscal 23 year. We also know that as all these pieces are moving, kind of going back and refreshing about what the process is for legislation, what the process is for the budget, we'll continue to do that and create some, you know, context setting slides for the 9:30 call and resources. The next kind of date that we're looking for the state budget is on March 1st. Governor Healy will release her budget recommendations for the next fiscal year, for fiscal year 24. So we'll all be tuned in for that. So in the next 2 weeks, we'll get ready to think about kind of where we have influence, where we need advocacy, and where are the opportunities are for us to take action. So thank you. It is Thursday, so we will have no call tomorrow. We will be back Monday morning. No, we will not be back Monday morning because it's a holiday. We will be back Tuesday morning. We'll send the schedule out for the call next week. As always, if you have any follow-up information, if you know of somebody or some topic that would be interesting to the 9:30 call, please let us know. We're happy to help get that going. Otherwise, thanks again to Naomi. Have a great Thursday. It's going to be unseasonably warm, so I hope folks have a chance to leave their Zoom screen and get outside. Have a great day.